Right, so hi everyone. I'm Lean. I'm the primary care clinical pharmacist tutor from the Herts and West Essex ICB Training Hub. And today I'm joined by a clinical pharmacist, Dimple, and two social prescribers, Alison and Kathy from the Broxbourne Alliance PCN. And today we'll be talking about the power of collaboration between the two roles to achieve better patient outcomes. So we'll start by introducing ourselves. So Dimple, would you like to introduce yourself?
Yeah, sure. Thanks, Lean. So my name is Dimple. I'm the PCN mental health pharmacist for Broxbourne Alliance in Hertfordshire. So majority of my role is based on reviewing and prescribing for patients who have got mental health illness, whether it be from mild to severe, and also conducting physical health checks for people who've got severe mental illness.
Okay, brilliant. Alison and Kathy, would you like to introduce yourselves?
Hi, I'm Alison and I'm a social prescriber for Broxbourne Alliance PCN, and I have been in this role for 4 years, supporting patients with non-clinical needs.
And my name's Kathy. I'm also a social prescriber within the same team as Alison, and yet we provide any non-clinical, non-medical support for patients ranging with anxiety, mental health, loneliness, isolation, and long-term conditions.
Brilliant, thank you. I guess I wanted to start off by asking you, Alison and Kathy, more about personalized care roles. So if we can let people, those who don't know what personalized care roles are, and then more specifically about the social prescribing role and the scope of practice for them.
So the personalised care team within Broxbourne Alliance is made up of two social prescribers. We have a couple of care coordinators, a health and wellbeing coach, and obviously we work closely with the mental health pharmacist. The personalised care team is to provide a holistic support to the patient. So having a look and unpicking issues a little bit more deeply, just to uncover any sort of underlying issues as to why they might be presenting with medical issues to start with at their GP appointments. And then as social prescribers, we often get people referred into us that, as I say, have social issues. So anything around anxiety, mental health, low mood, could be housing, debt issues. And yeah, we get the time to spend with the patients to understand what's important to them and then try and put in the right support.
Brilliant, thank you. And Dimple, when did you first become aware of the social prescribing role within your PCN?
So just a bit of my background, I've been a mental health pharmacist and worked in secondary care. So I first came to know the social prescribing role when I was working for community mental health teams. However, social prescribers were more based in the voluntary sector. So with how successful it was in terms of the outcomes it brought for patients I referred, when I joined the PCN, I was really pleased that we had two social prescribers within our team who we could directly work with. So I think having that knowledge of having worked with social prescribers previously, I already knew the value it would bring, and hence why I've worked really closely with Alison and Kathy.
Okay, brilliant. And so question to Alison and Kathy, how did you first start working closely with the pharmacists? And what sort of made you realize the potential benefits of collaboration between your roles?
I think it first came to light with a particular cohort of patients, starting with the patients that were deemed frail. Every year during the winter months, Kathy and I do welfare checks, doing home visits with bags of kindness for our patients. And as we were doing them a couple of years ago, we were coming across patients that were hoarding medication. So we then invited the pharmacist to come along to do some joint visits that they were able to do the frailty checks and to talk about any medication and take away any medication that was being hoarded. So that it started from there. But obviously, as we're working with different cohorts of patients, especially those with low level mental health, anxiety, it's been great to have the clinical perspective alongside as well as the holistic side of things.
Okay, brilliant. And I guess that brings me on to my next question because you mentioned patient cohorts. So are there particular patient cohorts where you feel that the synergy between a clinical pharmacist and a social prescriber can bring about where it's, particularly beneficial, I guess, the collaboration?
Yeah, so initially, obviously, anybody that's frail, so they'll do the frailty checks, elderly, as I say, with regards to sort of repeat prescriptions, and then any younger patients or anybody that's suffering with low-level mental health, anxiety, we work very closely with Dimple, and we offer joint appointments to make sure that we're limiting points of contact for those people that are already quite overwhelmed and anxious. So yeah, those two cohorts of patients particularly, we do tend to find we link in with the pharmacist quite a lot.
Okay, and how do you let patients know about the combined support that you offer, Kathy?
So we unpick with the patient obviously about what's going on, and then if we feel that we could work collaboratively with either the clinical pharmacist or the mental health pharmacist or other people within our personalised care team, like the health and wellbeing coach, we would explain the roles in full, give examples of the benefits of working closely and jointly with us, and then obviously gain their consent. Then we would have a conversation with the other member of staff and decide how best to pick that up, be it a phone call by them or a joint appointment, or meeting up outside somewhere, which we offer as well, green social prescribing. So yeah, we just work very closely and we're very patient led, so whatever the patient's comfortable with.
Okay. And Dimple, could you give us an example of where your collaboration really made a difference in a patient's life? So, you know, a specific patients that you might have worked on together where you've helped to improve their outcomes.
Yeah, I mean, I think we've worked together with several patients together, but I think one that comes in mind is someone who was presenting to not just myself, but to the GP for various physical health complaints as well as mental health complaints. So, you know, initially I had changed her antidepressant, but there was a lot of social aspects that I had identified, which I felt that she could benefit from that I wasn't able to necessarily provide her within my time frame. So I referred her to the social prescribers, and they have worked immensely with not just this patient, but her husband as well, who was somewhat, I suppose, behaving like her informal carer, but both of their mental health was being impacted by one another. But also by working with Kathy and Alison, it's enabled them to have fewer and reduced appointments with myself and the GP. And it's meant that they've been able to focus on more holistic things to try and improve their well-being, not just mental health, but, you know, physically as well. So, you know, and I think that's been a huge benefit to them, because it's meant less reliance on GP surgeries and more so being able to access social prescribing. And also a lot of it is about empowering them to take control of their own well-being, which I know a lot of work has been done with Kathy and Alison with these patients.
Oh, interesting. And I'm just curious to know, so how do you sort of work jointly on a patient? So do you sort of hold regular team meetings, or do you have, you know, where you discuss cases and review and plan the patient care together? And if so, how do these meetings typically work?
So we hold weekly personalised care meetings where this enables us to discuss any caseloads and to share ideas. And we also do joint patient appointments where appropriate.
The joint patient appointment, that's really interesting actually, because it's I guess it improves efficiencies, doesn't it? Because it's sort of killing two birds with one stone. So, and I presume that's something patients enjoy, because at least it reduces, you know, appointments for them as well. So helps to reduce the patient contact.
Yeah, and I think from our perspective as a personalised care team, we're just trying to make every contact count. And actually, if you've got somebody who is willing to engage with one professional, then by exposing them to another professional that can also have a good impact, you're more likely to get them engaged if they're having less contacts.
Mm.
And I think just in addition to that as well, I mean, we're quite lucky that we do, although we all work sort of in different bases, etc. But, you know, for example, on a Monday, we're at the same practice. So if, you know, we need to speak about something, then we'll just take an opportunistic approach to talk to one another. And then we've obviously got the kind of personalised care meeting on the Tuesday, but also just a matter of picking up the phone. There's often we just say, got so and so to discuss with you. Do you have time to just briefly talk about it? And then as a result of that, we then give feedback or just discuss cases, or if there is anything complex, then we just have that conversation.
Yeah, I think the key part is having those strong links between you. So having those strong relationships in place where you can just pick up the phone, so it doesn't have to be a formal means of communicating. So I guess I'm curious to know, has there been any sort of challenges or obstacles that you've encountered in your collaboration? And if yes, how have you sort of overcome that?
So I think, when a patient comes to see a pharmacist, for example, or a doctor, and the expectation is to be going away with something in terms of it being like a medication. I think I think patients are still very much working within a medical model. So I think the difficulty has been is actually trying to promote to people that actually this isn't necessarily the right option, and maybe to consider other options that approach their holistic that approach them more in a holistic manner. So whilst I think the role of pharmacists, I think that's also been a challenge coming into general practice, because again, people just perhaps see pharmacists in community pharmacies and not necessarily knowing that they can prescribe and offer these different services. But I think then when you introduce the social prescriber role, the general public maybe don't know so much about it. So I think that's probably where the difficulty has been, where, for example, I might try and explain the role and why I think this may help someone in terms of managing their health and well-being, and then they may not potentially buy into it because they may not necessarily understand how that may help them, and they may just want medication to sort of, as a quick fix, really.
I just think on the back of, just on the back of that, it's really important actually that, that the clinical pharmacists have a good understanding of what a social prescriber does, to be able to offer that patient the holistic support alongside their clinical journey. So it gives the patient a wider choice, if you like, of their treatment plan.
Yeah, absolutely. I think a lot of it is around patient education, it sounds. And I know that you've created leaflets as well to educate patients on the roles, haven't you?
Yeah, we have. We felt that it was something that would help clinicians. For example, particularly GPs, we may have limited appointment times to be able to, hand something out to a patient, or even, if they wanted to send it digitally. But it's just a matter of trying to explain in more detail about how these roles can benefit their health and well-being, so that they don't feel pressured to make the decision there and then and can go away and think about it, because it does say, explains really clearly about the roles and how it can benefit them, but also at the same time it allows them to feel empowered to make that choice if they want to engage with a social prescriber or health and well-being coach, and have the option to contact the practice if they did want to be referred onwards.
Yeah, and I'm curious to know how sort of successful is the rate of patient engagement when you do try to sort of refer them into, or explaining the role of social prescribers in your experience. Is it more often than not, or I'm just curious to know the uptake from patients.
I think the cohort obviously I deal with is, it's kind of a mixed bag. You've got some people that are very motivated and understand the links, and some people maybe not so much. So I think, although, I do feel, just kind of echoing what Kathy and Alison have said, that it is about the clinician to be able to understand the social prescribing role to a really good degree, to then be able to explain to patients. So I feel like engagement may be better when, if I am explaining it, because they've got a good understanding. However, it might be that at some point they may walk away, and then motivation may drop, or they may not decide to engage at that point. So I think and I think as a result of that, what we try to do is then hold specific target events, for our team, for the wider PCN team, to really make sure that clinicians and other healthcare professionals understand the role, to then be able to explain to patients and actually enable them to understand it more better.
Yeah. Yeah, no, absolutely. And I guess this question is aimed at sort of all three of you. So what advice would you give to other healthcare professionals who are interested in reaching out to different roles within the PCN to sort of help foster that collaboration that you have so sort of beautifully within your PCN?
I would just say, you know, it's a really positive experience, and I think that if you want the best outcomes for your patients, then obviously having a bigger team wrapped around them, it's almost like a formal MDT, but you've taken away all of the yeah, you just make it more holistic. You look at the patient, you look at what they need, and you link into whichever member of staff you feel is the best person to support them at that time. So for us, we feel it's really beneficial. And yeah, it makes our job a lot easier to be able to link in with other professionals very easily.
And also really take the time, if you've got time, because I know it's precious for everybody, but what really worked for all of us is to be able to shadow each other's roles. So you will get a better understanding of what everybody does. So definitely reach out to your team members and shadow.
Absolutely. I mean, that should ideally be within, you know, induction period, but even if somebody's already past that stage, there's
Yeah.
no reason why they can't, you know, take that time out. And obviously it does involve some, you know, maybe negotiating with having some free time, but I think it's absolutely, once you realize the value in doing that, then absolutely it's a good time, use of the time, really good investment. So I guess this brings me on to my final question, which again is aimed to all three of you. So what's one takeaway that you'd like to leave the audience who watch this video with about the power of collaboration in primary care?
I think for me personally, it's just make every contact count. So if you can even link in with your, you know, the people that you work with, just to try and get some advice before you make the contact yourself, so that you're actually managing to capture some of their issues in that one first contact. We find that that's, you know, the most positive outcome for the patient if you're making, you know, that contact count. And it's the same as if a pharmacist is going to be calling a patient, if they know that one of the questions is not necessarily medical, if they've already got the information from us, then they can do that initial piece of signposting. Then again, first contact's really powerful.
Absolutely. I love that. Really nice note to end with. Does anyone have anything else to add?
No. I mean, I think Kathy summarized it quite well, but I think the other thing as well is just that, you know, although we are really privileged to have social prescribers, you know, everyone can do light touch social prescribing. So I think it's really what I would say is it's really key to get to know your social prescribers, get to know what's available in the community, because, you know, again, if it's something that maybe someone doesn't want to be referred on to, everyone is capable of doing basic social prescribing to support patients, but it's just about getting to know what the role involves to be able to then I guess trying to, you know, promote it to patients.
Absolutely. Well, I think I love that first contact counts. I think not only is it so beneficial to the patient, I think because it encapsulates everything that, you know, all of the patient's needs and tailoring it to the patient. But I think also in terms of improving efficiencies and, you know, reducing contact time for the GP practice as well, which is really crucial during these demanding times. So thanks everyone for joining. Really appreciate your time, and we hope this will be useful for those who are watching. Thanks.